Hi everyone, my name is Molly and I'll be talking about hypertension for my final presentation of the GEO3452 class. And so just a general introduction to hypertension. Hypertension is also known as high blood pressure, and this is when the pressure in your blood vessels is too high, so this number is anything greater than 140/90. Factors that can increase your risk include older age, genetics, being overweight or obese, not being physically active, high salt diet, and drinking too much alcohol. There can be a lot of lifestyle changes like eating a healthier diet, quitting tobacco, and being more active that can help you lower your blood pressure, but some people may still need to take medications. And then for the history, it was first reported in a Chinese journal by saying that too much salt is used in the blood, the pulse hardens. And then in 1733, scientist Stephen Hales invented the manometer. And in 1896, it was finally medicalized by the recognition of hypertension by an Italian scientist, Scipione Rocchi, and he also made the sphygmomanometer. And this is prevalent because one of our presidents, President Dr. Roosevelt, actually died from hypertension. And so going off of that, there's a lot of consequences with this cardiovascular disease and symptoms as labeled here by the American Heart Health Association. And in fact, 40% of adults over 25 are diagnosed hypertensive, and 45% of deaths from heart disease and 51% of deaths from stroke are due to the hypertensive state. And there's a big global interest in this by the World Health Organization and the CDC. And so they've released a lot of guidelines for treatment of hypertension and also released and launched global health initiatives, including HEARTS, which includes 6 different modules to help with global and geographical distribution. So it varies across different regions and income groups. So the World Health Organization in the Africa region has the highest prevalence of hypertension at 27%, and the World Health Organization region of the Americas, so North and South, have the lowest prevalence of hypertension at 18%. And so this figure is from a study in the Lancet Review, and they use data from 1990 to 2019 of people aged 30 to 79 in population representative studies. And what they found when they used blood pressure measurements was that hypertension doubled in women from 331 million in 1990 to 626 million in 2019. And in men, it also doubled from 317 to 652 million men. And this was despite the stable global age standardized prevalence. And so today I'll be talking about a specific case study done in Athens, Greece, and this was labeled The Influence of Socio-Environmental Determinants on Hypertension in the Journal of Preventive Medicine and Hygiene. And so when we're talking about this conceptual design, what they did here was that they were studying hypertension and the social health determinants and environmental factors. And so they did this by looking at different data. So they used socio-environmental data, they also looked at spatial data, and they divided the metropolitan area of Greece into 5 different sectors. So they have the east, south, west, and north sector, and they looked at different variables, including socio-demographic, clinical, and lifestyle characteristics. They also looked at educational status, and they looked at the residential address. So most of these places were suburbs, but there were differences in the level of suburbity. And when we're looking at the triangle for population, habitat, and behavior, it's in the Athens metropolitan area. The habitat depends on the factors, and the behavior is also based on people's education levels, activity levels, and where they reside. So for the methodology, this is a cross-sectional study. So we know that they collected the blood pressure from participants at a single time point. So from 2001-2002, they collected for about 2,445 individuals, but they did not follow them through. And they reported 3 measurements to determine if these patients were hypertensive or not. So the systolic, diastolic, and if they had any special medication. And these measurements were all determined by health professionals, so physicians and nurses. And so furthermore, for data collection, for the survey, they used a population-based health and nutrition survey for those in the metropolitan area, and this was labeled the Attica study. And there were 3,000 volunteers, but only 2,445 individuals actually had hypertension. And so each of these socioeconomic or environmental variables was calculated for each unit, and the scientists decided to make these thematic maps for spatial variation. And so if you can see on the right here, these are the hypertensive population per 1,000 observations. So the different colors, so if it's red, it's very hypertensive. If it's green, they're not hypertensive, or there's less number per 1,000. And they use the ArcGIS version. And so for data collection, they use four different measurements: mean, minimum, max, and standard, as you can see here. And they did this for all of the 5 sectors, and they also did it for the whole study area. So you can see that they found a bunch of spatial and socioeconomic inequalities. So these are some of the factors they look for, so like green urban areas, average real estate prices, higher education population percentages, and they could tell and characterize each one. They also performed a PCA, or principal component analysis, and what this does is it determines which component was responsible for the highest variability in each section. So they had 3 components for Eastern, Southern, and Central, and 2 components were extracted for Western and North. And this can help determine the differences. And they also did a Smirnov test for normality for the average years of education, income, and real estate prices, but they showed that the variables were not normally distributed, and this means that the areas were different. And so in terms of results, the Eastern section had the lowest illiterate rate, so they had, and population density. The Northern section had a high concentration of high-income people and real estate prices, which kind of go hand in hand. And then the Southern section, they had high rates in all variables related to education. So in income, in how many years of school they were at, the real estate prices, those relate to education as well. And then the Western had the lowest socioeconomic status. So the lowest income population, the lowest real estate prices, and the lowest education level. And then the Central section was a little bit better than the Western section, but it was still low. But the Central section had a high density of population and a lot of immigrants. They also had a lot of green urban areas. And so when we're looking at this, the principal component analysis revealed that in those areas that had high socio-environmental status, it was negatively associated with hypertension. So high socio-environmental status means less hypertensive in Eastern and Western. And they had negative association with high education and financial level in the North and East, which is explainable. And in those areas with high income and real estate prices, they were negatively associated with hypertension. So if you have a higher income, you're not as likely to have hypertension. But this was different in the North and South because there was concentrations of high income, which may be that they were greatly urban, and so this may be due to limited green urban spaces. And so if there's less green urban spaces, there was an increased hypertension prevalence, which contradicted the initial statement. And then population density also had an impact. So population density can be a result of urban growth and can result on numerous stressors. But this was one of the first studies to determine the relationship between economic status, socioeconomic, and hypertension. And so they found in conclusion that as socio-environmental status of the area increases, hypertension rate decreases. And they looked at a lot of factors, and they were able to determine that these factors were important, and these can help public health policies and interventions in the future. Some of the limitations were the time difference. So they measured the blood pressures in 2001, 2002, but they actually collected the data for the income and real estate prices in like 2009 and 2011. So there was a big time gap in between when the data was collected. So that would be changed. And in addition, the Athens metropolitan region is very urbanized. So it can't be generalized to rural regions, which is of interest, especially for those in underserved or medically underserved populations. So you want to make sure that the rural regions are getting as much attention than the urban regions. So you can see here that most of the studies in Greece are done in Athens. So it would be helpful to look at studies that are done outside in the rural regions as well. But overall, I think that this was a good presentation and a good journal talking about how GIS was used. And these are my references, and thank you.